Good morning and welcome to our virtual town hall meeting. My name is John Henley and I'm chairman of the Vestavia Hills Chamber of Commerce. Today would normally be our monthly chamber luncheon, but obviously we're not able to have that today. With the recent changes in the last couple of months, we felt today was the right time to present information to our businesses and our citizens as we start the reopening of businesses and the city. I want to thank the City of Vestavia Hills for allowing us to conduct this meeting in the City Council chambers at the Vestavia Hills City Hall. I want to start by introducing the individuals participating in our meeting today. We have Ashley Curry, who's the mayor of the City of Vestavia Hills, Jeff Downs, who's the city manager for the City of Vestavia Hills, Karen Odle, who is president of the Vestavia Hills Chamber of Commerce, Dr. Wesley Willeford, who is medical director of disease control at the Jefferson County Department of Health and is joining us via Zoom, Donnie Dobbins, who is a chamber board member and senior vice president for commercial banking at IberiaBank, and he's joining us via Zoom today, Clabe Dobbs, who's a chamber board member and vice president and branch manager of Progress Bank, and he will actually be joining us here in the chambers later today. As we go through this process today, if you have any questions for the panel, we're going to have a question and answer session at the end of our meeting today. If you would, please email these questions to Karen Odle, and her email is kareno@vestaviahills.org. Again, that's kareno@vestaviahills.org. We're going to kick off our meeting today again with Dr. Wesley Willeford, who's the medical director of disease control at the Jefferson County Department of Health. And so at this point, we're going to turn it over to Dr. Willeford.
There we go. Okay. Hello, good morning, everyone. Thank you so much for giving me the opportunity to speak this morning. Like I said, my name is Wes Willeford. I'm an infectious disease physician. I work here at the Jefferson County Department of Health. I want to give just a brief update on where we stand with COVID-19 in the United States, Alabama, and Jefferson County. So in the United States, we've had approximately 1.3 million cases. Here, there have been about 80,684 reported deaths that have occurred since February 29th. In Alabama, we're currently in the entire state, currently at 10,164 cases with 403 deaths. In Jefferson County proper, we're at 1,131 cases with 61 deaths reported so far. As I'm sure you're all aware, Governor Ivey issued a revised order in this past week, moving to a safer at home strategy as opposed to a stay-at-home strategy. Key portions of this include recommendations for minimizing travel outside of the home, recommendations for wearing face coverings, recommendations that gatherings that cannot maintain at least a 6-foot distance should not occur. There had formerly been a limit on the number of people at those gatherings, but that was changed to focus more on the 6 feet of distance. And then allowing most retail facilities to reopen at a 50% capacity. I think allowing for athletic facilities to reopen as well. I do want to take just a couple of moments to speak on the nature of COVID-19. Of course, this is a virus that previously had not been known to cause disease in humans until probably December or November of 2019. That virus has since spread very easily around the world and has caused, as we all know, quite a bit of pain and suffering. The virus is highly contagious. It is much more contagious than the flu. It is predominantly spread through droplet contact with droplets that a person would breathe out or cough out or sneeze out from their respiratory tract. And then either you breathe in a person who has coughed out droplets, or you come in contact with the surface that those droplets have landed on. There may also be the ability to transmit in the air without a droplet of fluid, as we refer to as aerosol transmission. That is still being studied and something that is not fully understood yet. The virus does have a disproportionate effect on people who are over age 65 and older. They're the people who have had the highest rate of deaths in the hospital. The other major thing that we have seen is that it tends to hit people who suffer from diabetes, high blood pressure, chronic lung disease, or other forms of weakened immune systems much more intensely. And then we've seen varying death rates when you break it down by groups, but it's suffice it to say, the older a person is or the more medical conditions they have, the higher the likelihood that they will have a bad outcome related to this virus. One of the other things I want to mention here in the county, one of the ways that we've been working on moving forward is trying to increase our testing capacity. And thanks to the help of our medical organizations, our laboratory organizations, I think Jefferson County has made great strides in our ability to test. We have far more access to testing now than we did even a month ago. And that's something that we're very happy about and something that's going to be absolutely necessary as we begin to return to something resembling normal. I will say that the primary test that's used right now is what we call a PCR test, which is a test that looks for the genetic material of the virus. We've been doing nose swabs, deep nose swabs initially, and that's actually been found that you can do a less invasive nose swab that just goes a little bit up into the nose, so it's more comfortable for people and also safer to obtain for our physicians and nurse practitioners and other providers. So I think that's something that is going to make testing much more easy and much more acceptable as we go forward. Dr. Wilson, our health officer, has also convened a group of experts to begin working on just making sure we have a cohesive county-wide strategy. We're also partnering with Mobile County as well to aid them in their efforts so as not to duplicate work as far as trying to create good strategies for ensuring testing. I will say that there are some things on the kind of on the horizon that may change some of this. There's tests that are called antibody tests that have been out for a little while. The jury is still out on exactly how best to use those because a lot of companies are producing the tests and it's not clear yet which ones are going to perform the best. And so we're hesitant to lean into those until we have a clear front runner and one that performs as we want it to. The newest addition is what we call an antigen test. It's a test that operates much like a rapid flu test, where you're testing for a piece of the virus basically in a much more quick fashion. As those become more available and more convenient, I think that's something that we're going to see as kind of the way forward as far as quick, rapid turnaround for testing. I want to talk very briefly about the other things that we're doing here at Jefferson County Department of Health. One of the tasks that we do just in general, whether or not there's a COVID-19 going on, is what we call contact tracing. I'm sure you've all heard quite a bit about that in the news. And the idea being is that as soon as we have identified someone who has tested positive, we reach out to them. We get information from the state regarding these labs. We reach out to them. We ask that they isolate and ask that their contacts and their household isolate as well. The idea being is that by isolating people with known positive cases is that you can break their chain of transmission and prevent further spread and hopefully prevent spread in the community. I will say that of late, I mentioned our numbers here. If you've been over the past 2 weeks, we had a bit of a lull around, actually I would say around the middle of April, our numbers were going down and they started to increase about 2 weeks ago. And that's largely due to some issues that we've had with many of our local nursing facilities have cases of COVID-19 that we're helping to work with them to get this under control and try to minimize the spread further. But that's where a large number of our cases have been coming from. So I will close by just saying that we still have a lot of work to do with COVID-19. The battle by no means is won with the virus. It remains in the community, and it's something that we're all going to have to work very hard together to overcome. And I think one of the biggest things that we have to do is really encourage one, personal responsibility for people to take up arms against this virus, doing the things that we talk about, the washing of hands, the wearing face coverings. And again, I always want to make this point because I don't think I can say it enough. The face covering does not protect the wearer so much as it protects the people around them. And it's not a perfect protection, but it's something that can diminish the spread of the virus. And we also know that the virus can spread without obvious symptoms. So a person can be infected with the virus and may not get sick, but they can be spreading the virus. So wearing that facial covering is just another method that we have to slow down the virus and protect our neighbors around us. And you know, it's something that we're going to be watching very closely. We worry about as we begin to reopen things, and I think, you know, that's just public health where we come from, where we worry, we want to look out for everyone. But I think the biggest thing that we can do is really encourage people to do their part, do everything they can to protect their neighbors. But with that, I'll close, and I thank you for the opportunity.
Dr. Willeford, thank you, and for all the work that you're doing with the Jefferson County Department of Health and all your colleagues as well. Thank you very much. Next, we're going to move into Karen Odle, who's president of the Vestavia Hills Chamber of Commerce, and she's going to be first addressing some testing sites for COVID-19 here in Vestavia Hills. Karen?
Thank you. If you go to either the Jefferson County Department of Health or the Alabama Department of Health, they have listed sites for testing in our area, but 3 new ones have opened this week that I wanted to share with you. The first one is Your Kids Urgent Care. While it is a pediatric clinic, it has also expanded to adults. They've been approved to do that. So they take all ages, they do it curbside, and they will take insurance. They still do the nasal swab, but they're looking and working on going to the antibody testing. And you can find their contact information, all of these that I'm going to mention, on the Chamber's website. There is a COVID-19 response tab, and if you put that up or pull that up, see it right on the front page, you can go and see where we have testing sites. The next one is Urgent Care for Children. Both of these are on Montgomery Highway. They also have added all ages and will take insurance, and by appointment they will do curbside, and they're also doing the nasal swab. We have a business that's over on Acton Road, Any Lab Test Now. They do a lot of lab tests, but they are also offering both the COVID, the nasal swab and the antigen testing, and that is by appointment only, and it is private pay or a doctor's order. So those 3 have been added recently. So if you want more information on that, or if it's something you want to get more information about, go to our website and you can find details there.
And Karen is also going to address some cybersecurity concerns with us today.
Okay, when we have crisis, whether it's a pandemic or a hurricane or whatever, you know, the criminals come out. We've had reports of a lot of scammers. I sent out an email, I don't know, about a week or so ago, and I got a call that night saying, man, I'm so glad you sent that, because I started filling out this form, got to the bottom, and they're asking me for my credit card. So one of the main things I want to not only make you aware of, but your staff, your employees, you need to make sure that they understand the proper protocols, especially during this time. Don't respond to text, emails, phone calls, or whatever from the government. They're not going to text you and they're not going to call you. So don't respond to those kinds of emails. If you need information, go to irs.gov and get the information firsthand. If you see online offers about vaccines, as you all know, if you watch the news, there is not a vaccine at this time, even though they are advertised. So I'm going to encourage you to delete. Be wary of test kits. There's, as Dr. Willeford mentioned, there's still some testing being done on some of these, and there is not a home kit. There has been, I think, 1 home kit that's been approved, but it's by doctor's order only. So if you start looking at that thinking you're going to get a jump on things, don't do it. If you have robocalls, I know I enjoyed the time. That's probably the only positive I saw come out of the downtime was the robocalls sort of stopped, but they're back. I've already been getting those. So just be sure if you get robocalls, just hang up on them. We don't owe them anything. And of course, people are trying to play on your sympathy, so they're asking for donations. Again, as in any time, be cautious of who you donate to. Do your homework. Don't let them, pressure you into something. Hang up on them. You don't owe them an answer. But the main thing, and I've been talking to some of our law firms that we're seeing, and I've gotten them myself and my office staff has, is emails. you'll have emails that will either have an invoice attached or it will be embedded, and they're trying to get you to pay it quickly. What we're seeing is they're telling the people that receive it, maybe in accounts payable or whatever, they need to correct the billing, routing code. When you get those, that's a flag. If you're not sure about it, hover over the link, look at it. These scammers are very smart. They will change maybe a spelling, like Vestavia Hills, it may not have an S on the end or something. So be very cautious, and that's the main thing I want to caution you about and your staff. Let them know to just be wary, be suspicious of everything, and hopefully you won't be trying to call your bank or your financial institution trying to recover money. So that's one thing that we're hearing a lot of, and want to warn you of that and warn your staff. So that's all I have on that.
Thank you, Karen, for those updates. Next, we're going to be talking or have Clabe Dobbs with Progress Bank and Donnie Dobbins with IberiaBank. And Donnie is participating with us via Zoom today. Clabe is actually here. And they're going to be just talking a little bit about the Paycheck Protection Program, which has been front of mind for a lot of our local businesses. So I'm going to turn it over to Clabe and Donnie.
Thank you, John. Donnie will be on shortly as we're kind of tag team this together. We wanted to say thank you for the opportunity to share with the community, because obviously one of the biggest concerns these last 8 weeks is how can I keep my business open and viable? And as we all know, the federal government implemented the PPP program as part of the CARES Act to allow businesses to be able to fund their payroll, even despite the drop off or ceasing of revenues with the business. So where we are currently, there is still money available. As of last Thursday, basically the spigot was still on. So there may be some individual businesses out there that are still looking for a source to possibly get that funding, and I would suggest reach out to your local banker to begin that process, because once again, the banks have been the conduit of the SBA to get those funds to the various businesses. Now, we are about 5 or 6 weeks into the time period where the first wave of monies that started on April 3rd was dispersed, and as we all know, there's an 8-week period for the funds to be exhausted, and then the forgiveness look-back period will occur. So the biggest question we are experiencing at the banks right now is, what does that forgiveness piece look like? And unfortunately, at this time, all that any of us at any bank, no matter where you go, can tell you is the SBA has not finalized that guidance yet. What we do know is the banks will probably be the conduit again to reach out to the borrowers, gather that information to get back to the SBA. But as far as what that specific information is, we still at this time do not know exactly. Now, there has been a lot of loose structure around it, and I say that in the way meaning that most everyone knows that the majority of the funds were to be used for payroll, and there were allowances for some other forgivable categories. I think Donnie and I would both agree, I think the best bet for the borrower at the current moment is continue to work diligently with your accountant, continue to work diligently with your attorney, and continue to work diligently with your banker in order to make sure that as you're exhausting those funds during your 8-week period, which started on the day you actually received your funds and originated your loan, the key is making sure that you've got those records in order so that whenever they are asked for, they're able to be produced in a way that maximizes the amount to be forgiven. One other caveat to the forgiveness piece that not a lot of people were aware when this first came out that we have discovered. Early on, before the PPP program was introduced, the SBA allowed for individuals to apply for the EIDL loan program, which was directly through the SBA. And one of the pieces for that was a grant of $1,000 per head count, up to $10,000 for a business to use to kind of help keep them afloat until they either got the PPP loan or went the other direction. The only reason I bring this up as it relates to PPP is that if a business received any of that grant money, so for example, if a business received $5,000 of the EIDL grant and they had a PPP loan for $25,000, then the forgivable amount of the PPP is automatically reduced by that amount of the grant that they got from EIDL. So in this scenario, if someone got $25,000 of PPP money and got $5,000 of the EIDL grant money, then the maximum forgiveness they could get on PPP is $20,000. And the other $5,000 would then need to be worked out through the terms of the loan that the SBA provided through the lender to them. So once again, we have been very happy, both Donnie and myself, the banks we are with, as well as many of our other talented bankers and banks in town, to have provided probably over $200 to $400 million worth of money to inject back in the community to kind of keep these businesses open. And like I said, as we look to the forgiveness piece, if you are hearing from your banker that they don't know the guidance, that is indeed the message, and that's consistent amongst every one of us banks. Our compliance people, our legal people are working with the SBA diligently day by day. But as of right now, I think just with the ever-evolving amoeba-like presence the whole PPP program is, that finalized guidance for the forgiveness has not been shored up yet. So I want to make sure that message is heard loud and clear by the various business owners that, that we are still working. Once we get that guidance, we will get it out to you and facilitate it from there. So, and if Donnie, if you have anything to add in, I'll defer the floor to you.
Hey, can everybody hear me?
Yes.
Clabe, can you guys hear me okay?
Sir.
Hear you loud and clear.
Okay, great. Well, thanks everybody for allowing Clabe and I to join this morning. I think Clabe did a great job summarizing what he and I, and really doesn't matter what kind of banker you are, whether you lead a branch team, you're a commercial banker working with small businesses, large businesses, a private banker. Hey, this is what we've been up to for the last 8 weeks, and it's been challenging, it's been rewarding, it's been ambiguous, as Clabe said, but we are in position to help you. If your business has gotten a loan either through one of our 2 banks or another bank here in town, we're kind of all on a level playing field right now in terms of what we know and what we hope to know. The government was supposed to provide this guidance on the forgiveness protocol by April 26th, and that did not happen. Here we are on May 12th, and we're still awaiting it. One of the things, Clabe, you may or may not have mentioned, but this kind of amnesty date for those that may have determined that they wanted to go ahead and repay their loan has been extended. That was extended from the original date of last Thursday, May 7th, to this Thursday, the 14th. I'll tell you, just as an example with clients of mine, I mean, I've got a client that had a $7,800 loan, and I have a client that had a $5.2 million loan. So, it's good to know that we can help a wide range of clients with their needs and based on their workforce and keeping those people employed. I think that our business, our company was able to, I think we had over 12,500 applications for a little over $2 billion and at about a 90% funding rate. And I would think that our friends at Progress had a lot of success in getting these dollars like we did out to these small businesses in the spirit of the whole exercise, and that's to keep your people on the payroll. And, it's unfortunate that, the government, I told Karen yesterday, it's kind of like they scared the daylights out of some of these business owners in terms of, do I repay the money? Am I going to be able to make that good faith certification at the time that we get the guidance to go through my forgiveness application with my bank? I feel really good. I think, Clabe, you probably do too, that, our folks can demonstrate that they had economic uncertainty at the time of their application. I don't know a business that would not be able to state that. And so I think a good system of books and records, how the money has been spent, how you've maintained your payroll, how you've paid your rent payments, your utility payments, interest on mortgage, debt, and that sort of thing. I know that these businesses are working very closely with bankers, lawyers, and accountants so that they'll be in great position to have that loan forgiven. And that's the end in mind, is to be able to, have an interest-free loan that can be 100% guaranteed back to the bank, and at the same time, the client can enjoy using those funds and preserving their own cash flow during the, what was expected to be the very difficult time of the 8 weeks after their loan was originated. So we, again, are still learning. I would encourage, I know Clabe would as well. We are more than happy to take questions offline, to email us. working both Clabe and I with the board to share ideas. We've had a lot of opportunities to bring the board up to date with what we know and what we don't know. But I expect that we'll have guidance on this forgiveness any day now. And then when we get it, we'd like to channel that back through the board out to the chamber, and we'll have talking points and FAQs and that sort of thing. So with that, Karen, I guess we'll turn it back over to you guys. But again, feel free, any of you, to reach out to Clabe or I, and we'll be happy to assist however we might.
Thank you, Donnie. Clabe, also thank you for being here today. We appreciate that information. I think the takeaway from that bullet point is this: is if you're still not had your Paycheck Protection Program, and if you've not had that funded under the CARES Act, we would encourage you to reach out to your local banker. Because there is still money available. I know 2 weeks ago when we had a Zoom call, we thought the money was going to be exhausted fairly quickly, but it appears that there still is money there. I also want to thank Donnie and Clabe, and Donnie touched on this also. We have been having weekly board meetings via Zoom, and they have provided vital information to us as we develop our strategy week to week for the chamber on how to assist our businesses. So thank you very much to both of you for being here. The next thing we're going to move into is, I know a lot of, one of the common questions I get from different people is, how's our city doing? How are we doing as a city? And we have got Jeff Downs, who's the city manager with the city of Vestavia Hills today, to go over some of our metrics and our dashboard reports and bring us up to date on how the city's doing. Jeff?
Thank you, John. Karen, we appreciate the time to be able to talk about where the city is. The mayor and I are going to talk about some overarching themes, but we're also going to dive into some specifics. Before we do that, I would like to emphasize the fact that we're very sensitive here at the city on the safety and health concerns of our community, and doing whatever we can to assist in this new fight that we have. We also understand the plight of the small business. It's been very, very tough times. And while I have some good news from a city perspective on how we're handling this on the early side, that does not diminish the real struggles that small businesses particularly are having in our community. If you looked at sales taxpayers in Vestavia Hills, I emphasize sales taxpayers, those who sell goods and charge a sales tax. There are about 300 such businesses. 150 of those are categorized as small businesses. Those are the ones that struggle when you have times of sales taken away. And so we recognize that. And nothing that we say here today diminishes that thought process. That being said, my theme today is that as we are sitting here today at the 7th month of our fiscal year, we had the first 6 months of our fiscal year were the best 6 months financially in the history of Vestavia Hills. All metrics were hitting on all cylinders. We had extraordinary early results. Our business license collections, which represent gross sales of businesses, were extraordinary. Our utility franchise fees, which is based upon gross receipts of utility companies, consumption of energy, which show a matter of vitality in the community, were all up. Our ad valorem, our property taxes, while there was a mass appraisal change, are up significantly. All of this put us in a very good situation going into the pandemic. Also, we are supported by the fact that we have very strong reserves in Vestavia Hills. In fact, we have over $15 million set aside for emergency situations, just like this pandemic. Our early projections show that because we have done so well in the first 6 months of the fiscal year, And given the healthy reserves, we're probably not going to have to even use any of the reserves to carry through the rest of the fiscal year. We have something that we call the dashboard report. The dashboard report is something that we utilize every month to look at measures of our economy. And as I said, going into this pandemic, we had extraordinary times. 1 month into the pandemic, as far as a reporting period, we're still showing strength. Now, before I start going through the dashboard report and the facts, I think it's important to note we are different than Hoover, Alabama. We are different than Birmingham, Alabama. If you look at our categories of businesses, our largest taxpayers are grocery stores and specialty retail. Add pharmacy to that, and it represents nearly 30% of every tax dollar coming into our community are from grocery stores, pharmacies, and others. As well as the fact that as people use delivery services to their house, whether it's the simplified seller's use tax or actual collection of sales taxes based on the delivery address of online purchases or delivery services, we have had an extraordinary year. And 1 month into the pandemic, the numbers are nearly double what they were before. Because of the fact we don't have giant big boxes and malls and lifestyle centers of that sort, we will not see the same effect that other communities will see. So let's look at the metrics. We're going to pull up a chart showing total building permits from 2007 to 2020. The most important thing to note is on the far right hand of the chart showing year-to-date numbers in 2020. We have 101 residential construction permits issued for new construction this year and 13 commercial. At the 7-month point, we're nearly double what we were last year. We're more than what we were the entirety of 2018. And I know based on what's in queue, we're going to continue this trend and we're going to have the best year we've ever seen in Vestavia Hills as far as new construction permits. That is an important factor as we look at the rebound as we start coming back to life economically. Important to note. Second chart shows the approximate value of commercial new construction. The chart that's being pulled up onto your screen right now will indicate that in 2020, again, after 7 months, we're nearly where we were the entirety of last year. And this is for commercial new construction. Commercial new construction is construction that has a higher assessed value when it comes to property taxation, but also generally has revenue that helps running the city at least long into the future. So when you're running record highs on the value of commercial new construction, that is a great sign. The next chart that I want to talk about goes back to our sales taxes. And while there have been all sorts of ways to look at sales taxes, the first thing I want to look at here are sales taxes collected and reported in April. That represents sales that occurred in March, right at the beginning of the pandemic. In April, we had a record month historically for the collection of sales taxes. We were 5+% greater than where we were the same period, April of 2019. And you say, how can that be done? How can that be? Well, the reason why that's the case is if you look collectively at all of the grocery stores, pharmacy, and specialty retail for the month of March, reported in April, we had a 50% increase in gross sales. That's not a surprise. People know grocery stores were full, while retailers and small boutiques and businesses of that sort were down on average across the entire book of business 50%. Our larger taxpayers were also up 50%, which resulted in a record April in the midst of the pandemic. Again, I don't want to diminish the pain of the small business, but from the city perspective, because of the mix of our taxpayers, we actually saw growth in sales taxes for the reporting month of April. The next chart shows the fact of where we are annually with our sales taxes. And while it's maybe a difficult chart to quickly read, the takeaway is we have consistently over the last 7 to 8 years beat month over month sales results in Vestavia Hills, which is a good sign that once we get out of the shutdown, we should be able to rebound in a fairly healthy manner, because we have continually had that strength, and our taxpayer mix is supportive of that. Next chart, I think, is one to never underemphasize. Where do our sales taxes come from? And if you look at the pie chart, the number one area where we get sales taxes are for businesses that don't even exist in Vestavia Hills. If you use Target to ship a item or groceries to your doorstep, Vestavia Hills gets sales taxes. It's reported as out of area. If we have massive amount of construction going on in our community, the use tax associated with construction materials get put into that category. So because we are importing goods and services into our community, it helps us mitigate the issues of the pandemic. It also emphasizes the need to keep healthy construction. And if you go back to the first chart that shows where we are with that, it's a positive sign, which is a positive sign for rebounding as well. The last chart that I'd like to show is simply what we call the Simplified Seller's Use Tax Report. These are basically state collections of use taxes associated with online sales. We continue to have an extraordinary year. This extraordinary year is based on a number of variables, but also the fact that obviously people are doing more online purchases. And as we get into a new world, we have to support our local businesses and our brick and mortar, but it's important to note also we're starting to collect some of that online sales as well, to try to create a level playing field for all. So those are that's the last of the charts to show. I think the takeaway is we as a city are in a good situation as far as our financials. Our economy was extraordinary before the pandemic, and our contention based on our look at the local Vestavia Hills economy, we're set up for a healthy rebound as the businesses come back to life, which is a good sign. And I know the mayor is going to talk about other aspects of this that are good signs for the future. And I hope this is helpful as you start exploring what does the post-pandemic Vestavia Hills look like. Thank you.
Thank you, Jeff, for that report. I want to go ahead and mention again, we're going to have a question and answer period after Mayor Curry speaks. So if you've got any questions that you want to present to the panel, if you would, please email those to Karen O at VestaviaHills.org. Again, that's Karen Odle's email, which is Karen O at VestaviaHills.org. And our next speaker today is going to be Ashley Curry, who is the mayor of the city of Vestavia Hills, and he's going to update us on our pending projects in the city. Mayor Curry.
All right, thank you, John. Karen, thank you for organizing this. We certainly welcome the opportunity to talk about things in Vestavia Hills. But I want to follow up on Jeff's comments just briefly and say that our financial standing that we're enjoying is because we have sound fiscal policies. And you can credit your council, you can credit your city manager, the finance department that does our budgeting. We are doing responsible budgeting, and it's just amazing that we're able to, that we've been able to surpass that, and we have the strength to withstand something like this pandemic. The recovery will happen. We don't know how long it will be for everyone, but the move last week by Governor Ivey to open the small businesses will help us immensely. And I have written a letter to the governor thanking her for taking our concerns into consideration, and don't know what role that may have played in her decision, but if it contributed to it, we're certainly delighted that she did what she did. Now, other positive news that you will see coming in the next months or so, I'd like to mention a few things that we can look forward to. One, the Publix at Liberty Park is projected to open in June. That will be especially helpful to Vestavia because people that had shopped in other municipalities that live out in that neck of the woods will now be shopping, hopefully, in a store located in Vestavia Hills. I'd like to also mention the Publix on Rocky Ridge, the old Western that I've gotten so many calls about, should open, we're projecting in November. So that'll be something very positive for the city. You may also have seen that Todd Mall was recently purchased, and that will be opening as a medical office complex. Another items that you could look forward to is a new retail center at the intersection of Dolly Ridge Road and Crosshaven Drive. Another item is a mixed-use development, office and retail, in Liberty Park that's going to include a regional office for the Community Bank of Mississippi and also a headquarters space for Stone Building. So things are progressing, and there are other projects that we could probably mention. You'll have new development, of course, continuing at our city center. But all these things kind of get lost in discussion as we deal with the pandemic. But I think there's a very bright future, and you're going to see some positive things happening in Vestavia Hills.
Thank you, Mayor Curry, for all those comments and everything that's happening with the city. We're going to move in now, I believe, to our question and answer session. So we're going to give us just a moment to pull these questions up, and we'll get those in for our panelists.
First question comes in is for Jeff Downs. Does the total value of commercial construction that you shared in the value of the projects that are funded by the city and or the Board of Education, does that include that?
It's projects that commenced this year. Many of the public projects were commenced in a previous fiscal year, but yes, it does include public projects as well. I think it's important to include the public projects because they have a catalyst effect on efforts to grow and help our business corridors, whether they're on Highway 31, whether they're on other places as well.
That's the only question I have had submitted. Cinnamon, did any come in through chat? So I guess everybody, y'all have done a good job of explaining everything. If there are any other questions, be sure and send them to Karen O at vestaviahills.org. And we will, we will try to get them answered for you.
Another minute or so, and so if you have any other questions, come in. And anyone else have any comments while we're waiting a couple of minutes on the,
I think it's just a theme of ours that to keep upbeat. We're in a depressing time. We hear the health stats every single day on every news channel. And I think to emphasize the fact that there are so many positive things going on in our community, it's important to note that. We did not even touch on the fact that the mayor and council last night approved another project within the series of quality of life projects that are going on in our city, a new community building. The fact that we have, outside of all of these numbers, a record number of infrastructure projects going on now that will also help in the business climate. Our number one complaint area in the city, traffic and transportation wise, is Crosshaven Drive. On June 15th, that project will start full bore. That will ultimately help the flow of traffic, help the business climate in Cahaba Heights, as well as the multitude of other infrastructure projects we have going on as well.
Karen, do we have any more?
That's it.
Well, we're going to go ahead. If you do have any questions, please go ahead and send those to Karen and we can respond to those via email. We're also going to post this Zoom meeting. We've recorded it, so we're also going to be presenting it later today, I'm assuming, for anyone that might want to relook at this or share it. I want to thank all of the panelists again for being here. Again, Karen Odle, Mayor Curry, Jeff Downs, Clabe Dobbs, Donnie Dobbins, and Dr. Willeford from the Jefferson County Department of Health. We also appreciate all of you being here today. Thank you for participating. Thank you for being here today. And as always, if you have any questions, please feel free to reach out to the chamber, reach out to me personally, or reach out to the mayor or Jeff, and we'll be happy to respond and answer any questions that we can. Again, a lot of things are still unknown at this point, but we're going to do everything we can to continue to push out information to everyone as it becomes available to us. So again, thank you guys for being here today. Thank you for participating, and hope everyone has a great day. Thank you very much.